Today, we're going to talk about continuous glucose monitors. Now, we use these quite frequently in our practice, especially for our pre-diabetic or insulin-resistant population, because they are a great tool for behavior change. They let you see what habits are really helping or hurting your blood sugars, so then you can make changes. So we're going to view a couple curves today.
Okay, so this is a good example of what I would consider a sharp spike. So we can see at about 1 o'clock, it started going up, and then about 2:30, it started coming down. And I'm saying that it's sharp because even though you can't see the scale here, this actually spiked about 80 points and looks like maybe it fell 90 points within that time frame. So within that 2-hour time frame, normally we consider a spike anything above 30 to 50 points. I don't know what this person ate for this meal, but I would bet that it was something pretty high in refined carbs, maybe a treat, maybe a piece of cake, something like that. This is a great example of a very steady curve. Certainly this person ate over the span of 8 a.m. to 6 p.m., but you can see there's very minimal spikes, very minimal drops, very balanced. This person is probably not insulin resistant and they ate a very balanced diet. This is a great example of a meal that was probably high in carbs, but also high in fat and or protein. We know that fat and protein help stabilize blood sugars, but when combined with a high carb meal, they often help stabilize them high. I would expect blood sugars to look like this after maybe some pizza, maybe some French fries. This is a great example of a slow, more gradual spike, and then a more gradual coming down from that. So you can see the spike started around 9, and then peaked around 10, started coming down gradually at around 10:30. So nothing to be super alarmed about. It was a little bit of a spike, so it spiked more than 50 points, but didn't have that quick rebound fall that we saw earlier. So it was probably slightly more balanced meal, even if it was higher carbohydrate.